There are three conditions in which you may consider the use of supplements. One is sleep, the other is pain, and the third one is mood. So let's take sleep first. Most people know about melatonin, and if they're on a supplement for sleep, very often patients will tell me they're taking melatonin. However, melatonin doesn't really work very much for your routine difficulties with sleep. They do help with jet lag. They do help with children with autism, for example. But beyond that, melatonin itself is not a good sleep supplement. Most people also don't use it properly. They take it right before they go to bed, and it needs to be taken a couple hours before you go to bed. More importantly and more effective in my experience, in my clinical practice, is something in which melatonin is mixed with other types of herbs that have been shown in clinical trials to help people sleep. Things like valerian, passion flower, theanine, and other types of approaches. So you need to look for a mixture that's high quality, that doesn't interact with any medications that you're on. Look at my guide on my website, and it'll give you some suggestions. The second area where supplements can be very useful is in the management of pain. Now, most people have an inflammatory process, although not everyone, and anti-inflammatories can be beneficial if they're properly used. The evidence here is very mixed, and so again, I refer you to my website where a recent study that has visually presented what the evidence is for different supplements in pain, published by a military group, is very useful for civilians too. So I suggest you take a look at that. It's called a bubble chart. But things to think about if you have inflammatory pain like arthritis or back pain, supplements such as curcumin, which is an anti-inflammatory, caffeine, which actually can enhance the effect of standard medications like Tylenol, acetaminophen, or ibuprofen, for example, can also be helpful. And then two other supplements frequently used are capsicum from red peppers and willow bark, which is actually where we get aspirin from the bark of the willow tree. Those are supplements that sometimes can be very useful. Don't substitute those for a good anti-inflammatory diet, however. Diet can have a huge effect on reducing inflammation and reducing pain, even without supplements, so make sure you pay attention to that. The final area where supplements can be useful is in mood management. For example, ginkgo biloba, which most people think is a good memory enhancer, and actually the evidence shows that it's not, is good for treating depression. And so ginkgo biloba, properly used, can sometimes improve mood. St. John's wort that I mentioned before is also effective in treating mild to moderate depression, but again, be careful you don't use it with other drugs because it interacts with many of them. And finally, lavender can help regulate moods and sleep. It's a very safe supplement. You can put it into something that creates an aroma in your room. You can put it on your pillow, or you can even take it as a supplement, and it helps regulate mood.